Ms. Chair and Ranking Member McGovern, it is shameful that at a moment when millions of Americans are losing access to health care, the Rules Committee is meeting not to consider serious legislation that would help women and families, but to debate a bill that does absolutely nothing to make health care more affordable or accessible. It's equally shameful that legislation designed to score political points with attendees at this week's anti-abortion rally here in Washington, D.C., is being prioritized over addressing the very real health care crisis facing women and families across this country. This partisan Republican bill, H.R. 6945, would divert federal resources away from needy children and families and towards anti-abortion centers. The bill would amend temporary assistance for needy families, the law in order to block the federal government from monitoring state spending of TANF dollars for these centers. In effect, this bill would permanently exempt states from regulation and oversight of expenditures of federal TANF dollars on these centers. These so-called crisis pregnancy centers routinely masquerade as legitimate healthcare facilities while providing misleading or medically inaccurate information designed in order to prevent women from accessing abortion care. They frequently disguise themselves as real clinics, dressing staff in scrubs or white coats and deliberately misleading patients about who they are and what services they provide. This bill legitimizes coercive anti-abortion tactics designed to block people who are facing life-altering medical decisions from receiving truthful, medically accurate information about their reproductive health care options. And this bill is one more step towards Republicans' true objective: total control over Americans' private health care decisions and a nationwide abortion ban. In Iowa, an OBGYN has seen patients who visited these centers and were told that using contraceptives was the same as having an abortion. She's seen patients who've had miscarriages and ectopic pregnancies because they were misdiagnosed by these anti-abortion centers. These women were told that their pregnancies were in the early stages or they were experiencing normal amounts of pain because the staff members they saw were not actually qualified medical professionals. As a result of this substandard care, these women showed up to the hospital needing emergency care and surgery to save their lives. And in Chicago, a woman seeking an abortion was deliberately misled by a fake clinic, subjected to graphic videos, and was told that having an abortion would make her infertile. After giving birth, she lost her job and health coverage, and then the so-called clinic never offered real medical care or follow-up support. Because these centers are not actual medical facilities, they are not even subject to HIPAA's privacy and security protections. Their staff can spread misinformation without consequence, collect sensitive personal data under false pretenses, and face little to no accountability for the harm that they cause. In fact, a study of 607 anti-abortion centers across 9 states, nearly 2/3 of such centers nationwide, found that they promoted patently false or biased medical claims about pregnancy, abortion, contraception, and reproductive health care. Fewer than half reported having a licensed medical professional on staff. During our markup last week, Democrats offered a series of common sense amendments that would have allowed funding to these centers only if they could demonstrate that they actually provide medically accurate information or do not harm women's health or economic futures, or do not mislead or coerce patients. Committee Republicans rejected all these amendments, making clear that their purpose is coercive propaganda, not support for pregnant women and families. If you truly want to support parents and families, Democrats in the Ways and Means Committee would support the establishing of paid family and medical leave, making child care affordable for working families, or reversing the $1 trillion cut to Medicaid, our nation's largest insurer of children and births in this country. Instead, at a moment when millions of Americans are going without health care or paying exorbitant costs just to stay insured, this committee is debating a bill that does nothing to address these crises. This bill is merely an attempt to appease a far-right fringe group in town for its annual conference. The best thing we can do is to support pregnant women and families today, and we can do that by rejecting this legislation. With that, I yield the balance of my time.
Thank you, Ms. Chu.